Okay, so today I'm going to be showing how to prime tubing. So I have my materials here. I have my tubing with the spike, and then I have my saline bag, and I also have my gloves because I am going to have to be performing hand hygiene and then donning my gloves so that I can keep this procedure sterile. So basically the object of priming tubing is to make sure that no air gets into our patient. The tubing does a nice job, and as long as you know what you're doing, no air should get into the patient. So the first thing when I walk into the patient's room, I want to make sure that the medication that I'm going to be administering is the medication that's supposed to be going to the patient that of the room that I'm walking into. And then after I would do my hand hygiene and putting on my gloves, I want to make sure that I label the saline bag with the date, the rate of infusion, the patient's name, and then I would go ahead and initial the bag as well. And then you also want to make sure that the saline or the medication isn't expired, because that should never be good. So I'm going to perform hand hygiene, and then I'm going to put my gloves on. Mrs. Bush, now I hope your baby's doing okay. What a time to be raising a newborn with this pandemic going on. I also apologize for the desk being so high. It's just the best place that I have in my little apartment, basement apartment here to do this. Okay, so now that my gloves are on, I'm going to take the saline bag. I'm going to flip it upside down. So on these bags, and I haven't seen all of the type of medication bags, but I'm sure that all of them are kind of like this. It has a little tab here that you can twist off. You kind of got to twist it off pretty good here. You want to make sure you don't touch the opening that's going into the saline because that's sterile, so you don't want to do that. And then I would take the tubing here, take the spike, twist the top off, and then again, don't make sure not to touch the spike because that's sterile. So this is going to be going into the patient, or going into the saline bag, which ultimately I guess goes into the patient. Okay, so twist it on down in there like that. You can twist it upside down, making sure that the saline bag always stays higher than the patient, because that way there's no air that'll get into there. So then you do this. My hanger's a little low here, but you can get the picture if the patient was laying on the ground, I guess. So there's that. It just hangs right there. And then you want to make sure when you're priming the tubing that the clamp is closed so that no water is able to escape or anything like that, or no saline, any fluids. And so basically you also want to fill the drip chamber. I don't know if you can, I'm sure you can see it, but fill the drip chamber to about a third or half before you start going. But basically that's how it works. It'll start infusing into here, and then you can, once you undo the clamp and put it into the patient, and make sure you undo the clamp afterwards, but once you put it into the patient, you can start infusing your medication. So, and then after that, once you do that, make sure to assess your patient. You can do vital signs if you want, but I would say probably wait a little bit on that. But just to make sure everything's okay, make sure there's no redness around the area or anything like that. All right.